Hello and welcome to Scilence, a podcast that gives women in science, technology, engineering and maths, or STEM, an opportunity to share honestly and openly about what it's really like working in these typically male-dominated subjects. Each week, one woman shares her stories and experiences. She could be a public figure, the girl next door, or someone from a far-off land. The point is she'll be deliberately kept anonymous and disguised to ensure that we're not distracted by the details of her achievements, her labels, or what she looks like. I'm Dr. Shanice O'Mara, also a woman in STEM. I studied mechanical engineering and ended up as a television broadcaster. I've worked on and reported on some cutting-edge technology and innovation over the years, and through my television work, I've met some incredible women from a diverse range of STEM fields. And you know what? I've been more amazed about what I've learned from these women when the cameras have been turned off and they're just being themselves. These women have amazingly impressive CVs, but most importantly, they're human, just like the rest of us. And it's that off-air honesty that I'd love to share with you through Scilence. This week, my guest is in the field of speech and language pathology and therapy.
Hi, Shani.
Welcome to the show.
Thank you. Thank you for having me.
Thank you so much for agreeing to be on. I must say, I don't know much about language and speech pathology. Can you explain what it is that you do?
Sure. We work with children, babies, children and adults who have either acquired or have congenital difficulties, which meant they have difficulties with communicating and also with swallowing and feeding. So we work often as part of a multidisciplinary team with many professionals within the healthcare to support them through being able to assess and help provide intervention to help to improve lives and quality of life and activity of life in both of these areas.
That sounds like such meaningful work. Did you always know that you wanted to go into a field like this?
I think I did. I started off when I was probably doing in school. Always had a passion for communicating, travel, meeting people, exploring the world out there. And I felt I had a natural aptitude initially with languages. And it wasn't until I was exploring at college what I could do with the skills I had that I was introduced to the world of speech and language pathology and therapy, and went to observe a teacher, thinking this might be another route to go down, and saw there were some children in her classroom that needed more support with differentiating the curriculum. So when I inquired about what role she would have with them, she said, we actually have a speech, a language therapist come in and support these children. So I think I came from very much a linguistic background, but felt it opened up a whole world in science that I hadn't really appreciated that I could be really develop skills in. And it really drew in some other, I suppose, aptitudes of mine that I hadn't appreciated I had across both fields of, I suppose, humanities, but also science as well. And it was literally by reading about what we do that I felt that this was actually me, and it just fulfilled so much with working with people and meeting people, but also helping look at, well, what happens when things occur and with the human body, whether you're born with something that's a difficulty or it's something that you acquire. And with communication and eating and drinking being such an essential need for us all, it just really, played to my interests, I suppose. It brought so much just going into this one area. It just truly did open up a world for me. And I'm still very, very passionate about it now, 20 years on, or even more if you include the student, 25 years on.
So what were the steps to get to where you are today? Because often people think of STEM as chemistry, biology, math.
I'd say that to be able to do the role I do now, I first of all did a bachelor's of linguistics and psychology. And within this linguistics, it breaks down into all areas, including psychology, philosophy, sociolinguistics, child acquisition, disorders in communication. phonetics and phonology, lots to do with physics in terms of the audiological perspective. So there's many areas there that we acquire the different modules in. And then you can do an undergraduate course in speech and language therapy. It's known as many different areas, so you might come out with a degree in speech sciences, or it might be speech and language pathology and therapy like I did. And then I went on and did my undergraduate in the UK. And within that, we had our training in paediatrics and adults over a 2-year period. And there's such a range of modules that we covered that enabled you to, we needed to have experience not only in the language aspect of development, but also specifically from a science perspective and a medical perspective was the human body, anatomy and physiology. So you had your biology, we used to about chemistry, anything to do with the brain, essentially knowing how the body works, but also in terms of what we can understand about how we process language, how language might be stored, and if damage occurs, such as when you've had a stroke, what that could mean in terms of the breakdown. And actually in itself, communicating and eating, drinking and swallowing is in a sense a science itself. So I think it's not just like you said, you'd assume it'd be more of a humanitarian area, but it does have a real pull on science as well.
Do you use a lot of technology to do your job?
Yes, definitely. So if we're working, say, with somebody who's had a swallowing difficulty, then we would use equipment such as X-rays. It's called video fluoroscopy, where you would do a moving X-ray of somebody's swallow. You also could do a FEES, where you would have a scope that goes up into the nasal cavity and into the throat so that you could actually diagnose any swallowing difficulties, and also pick on voice difficulties as well with a stroboscope, working alongside our ENT colleagues. We also do a lot of voice work as well, using various pieces of equipment such as VisiPitch. So you would be looking to see how you could provide biofeedback to children and adults, so they can see how they've improved with their pitch and volume, phonation, etc. So there's many, many different types of equipment that we would use, and particularly when we're doing work alongside, with it being within, let's say, a hospital setting, you need to know lots of other details around the equipment that's being used that informs you around your assessment. So when we're working with babies, for example, knowing with their SATS monitors, if they're on ventilation, knowing around how that whole system works to support children who have tracheostomies, for example. So there's various types of equipment that we would use to support our diagnostic assessment as well, but also for intervention.
What do you love most about your job?
Helping, supporting people. I remember when I went for my interview to do the course I did, my master's, they asked us, what is it you like about, what do you imagine you like about the job? And I said, it's the puzzle. It's the working out why someone has a communication difficulty. It's knowing how you can really improve on their life, helping people understand why there may be a breakdown with their communication, helping families where a baby's been born prematurely and they really want to get going with helping them with feeding. And you're able to provide that support with them to help them understand what's occurred, why they may be having difficulties, working with them to really empower them so that they feel that they've got control again. And giving people their voice. It doesn't always have to be that people are actually speaking verbally. We communicate so well non-verbally as well. And I think that's what I really, having children of my own is something I'm really passionate about, is children, and I suppose adults as well, we all are communicating on a daily basis. And it's not until that's taken away from you or things start to deteriorate that you really see the value we place on that interaction. It's a basic human requirement that we all need. Eating and drinking, socialising. It's not something like when you break your arm, you go and you can have it put in plaster. that's more visible. It's almost like it's hidden when you've got a communication difficulty. People don't often understand how to communicate with others, such as people who've got autism or someone who's had a stroke, so their speech might be a bit more slurred. A child in the classroom who might present as if they've got behavioural difficulties, when actually it could be that they've got a hearing loss, or they can't use the language that they want to use, or they can't understand what's being asked of them. So the quickest way they can communicate is by demonstrating inappropriate behaviour sometimes, or for them it is appropriate because it's the most effective means. And I think that's what, for me, I just get so much reward from just seeing that light bulb moment on the smallest of things. Just knowing that you've just helped made an improvement on somebody's quality of life.
Your work sounds so meaningful. And I must say that out of all the interviews I've conducted, your career sounds like you draw on the most maternal and feminine qualities that women have. What's the gender balance like in your line of work?
That's a very good question. It's a very highly dominated female profession. It's quite rare we do have males in our profession. On my course, there were 2 males, and in the job I was working in previously, we had 2 in a department of 80. And in my current department of 10, I have 1 adult therapist. However, at a hospital that's in the same area, there are more male speech and language pathologists working here. So I've felt more where I'm based overseas. We have more male therapists, and particularly I'd say in paediatrics, which I work in, there's more females, but maybe more so in the adult population there are more males. But I know it's something that the higher educational bodies are trying to really influence and really promote. So I know within my professional body back in the UK, on the board of directors and working within the Royal College, there are representation of male and female as well. So that does have a good influence in promoting that as a profession.
So are they trying to promote more men into the profession?
Yes, definitely. I think it's just they're trying to promote the awareness of what we do. It's very new here where I'm working in terms of, and I think generally internationally, knowing the role of a speech and language pathologist, it was very much perceived as the twin set and pills and elocution lessons. I think that's probably where, I don't know if that's where it was, how it was perceived originally, but I know there's been a lot of work and campaigns around placing the value on, for example, we know that in the UK, 70 to 90% of youth offenders through assessment have shown they've got communication difficulties that haven't been picked up at school. And I know the Communication Trust has done a big piece of work around this to really demonstrate that the earlier that we intervene and actually diagnose these children, the impact it has on society in the long term is just phenomenal. Because if you leave school with no qualifications or poor communication skills, I suppose your ability to then go on and be employable is limited and restricted, and often that leads to poor socioeconomic outcomes for you, and therefore lead to more youth offending occurring. So it has such an important role, and we're just trying to really promote the message out there with a Giving Voice campaign in the UK. I've tried to bring this into the country I'm in at the moment, and I'm still continue to be surprised that that they don't recognise, what people out there don't recognise what we do, or this misunderstanding about what our role and contribution can be.
Your field does sound relatively new. Why do you think there is an imbalance of gender in your profession?
I think because it communication itself, and I suppose the kind of work we do, like you said, it almost seems it appeals to the maternal side. It was interesting when you said that, and I was thinking I hadn't really ever considered that. I think it appeals to more to my personality and my interests, and my aptitude for language, and I suppose literature as well, and unpicking the psychology side of things. And I suppose for me, speaking with other male colleagues, they came later into the profession, or had come from a background of, say, drama, where they'd studied drama, or more humanities type subjects or arts. I'd say within physiotherapy, you tend to get more males than females, and occupational therapy, again, it feels it's more of a female dominated career.
What's it been like working mostly with women? I mean, it sounds as though you may not have any experience of not working with women.
Well, we work in multidisciplinary teams, so we work a lot with paediatricians and physicians, ENT surgeons, cleft lip and palate surgeons. You go into schools, you work within community settings. The nature of your work is from a clinic as a clinician. Say in the hospital setting I'm in now, we work alongside IT. We have overlap with many male professions, or males, should I say? But I'd say a lot of our role as well is within leadership. And again, I'd say within that leadership and management role that we work towards as we advance our career, does also provide us with more opportunities to work with males as well. So I don't know if it's more to do with not overlapping with the males themselves. It's more the actual career I've gone into, by its historical nature, has been more female dominated. And in terms of working with that, I think the main thing is I think you get a real balance of different types of personalities, really. I mean, not every female's the same, as you'll know. I just think it's the recognition, one, of the profession, but two, as a female yourself in a setting, whether it's within a hospital, whether you're in a meeting, around whatever setting you're in, whether you're going to see someone at home, in their home environment. I think it partly for me is the view of what the profession's about. It's not till, say, we're in situations where we're having to maybe challenge recommendation that we've provided around a child's feeding. There's times when a consultant, whether they're male or female, may want to override our decision. And I think it's more around us being able to feel confident that we could have that discussion as professional to professional. I'm fortunate that I've never been asked where I've been challenged in terms of my being a female. It's more what I represent as my profession.
Yeah, because it sounds like you have an extremely varied palette of skills. And so I'm kind of assuming that you're just a highly adaptable person, and it's not necessarily gender specific.
Yeah, I don't know if that's just partly to do with me as a person being adaptable, but also I think the profession itself has had to adapt. And I think with the way that the courses are structured now, and the opportunities and the recognition of what the role's about, and also the outcomes and the the value that from patient feedback that we get, I think there is more and more awareness now. I mean, Stephen Hawking himself as a male, if anything, really promoted the profession in terms of using assistive technology. There's been lots and lots of I don't even know if you heard the year of communication when the King's Speech was out, the film was produced. Just that, what that really promoted in terms of speech and language difficulties. And it was really interesting that it was a male speech and language therapist that, that was there to support the King. So,
after all the work that female speech therapists do.
Yeah. So that was really interesting that was the perspective that was given. And a speech and language therapist who was female did come and work with Stephen Hawking as well. So I think it says maybe the role of a woman in the profession, in terms of being as a working professional, as that's evolved, and therefore has the profession itself as well. It wasn't just thought that it was one, a male that could have this science background, but also I think the profession itself has grown in terms of what our role is. I think it must have been about potentially 30 years ago that we weren't working in the area it's called dysphagia, which is the difficulties with eating, drinking, and swallowing. It was a big focus was on communication, but as more and more research is done and more children are diagnosed, there's an increase in the diagnosis of autism. We know more now around cerebral palsy. We know more now around motor neuron disease and Parkinson's disease. We have a lot of celebrities that come and talk, promote and talk about their own experiences. Just as I suppose disability is accepted across the, nationally in the UK, throughout the world, so is having a communication difficulty and mental health, etc. So I think a society grows, more knowledge around different areas grows as well.
It's amazing how this field affects so many wider issues.
It does, yeah.
What I'm getting from you is a sense that you really enjoy what you do and you get so much meaning and purpose.
Yes.
From your career.
Definitely.
What are the disadvantages of what you do?
The disadvantages?
Yeah, is there anything that you dislike or are challenged by?
It's a good question. I think, if anything, what I've recently experienced, and I don't know if it's just coming from a healthcare system that was government funded, in terms of career pathway advancement, we had to take on more of a managerial role or research type role to enable us to advance from a monetary angle, but also in terms of advancing through the, levels. And I suppose it's quite hierarchical that way. It's quite rare now to find where you can become a clinical expert in an area. But in terms of advancing yourself, you do get pulled into, and I'm now working as a manager in speech and language pathology. I found that my clinical work is reducing down, and I'm using my experience and knowledge to really evolve the services, improve services, evolve and develop staff, and be part of a bigger, more strategic level, which is not where I started from. But because what I really value is that I can influence that. I suppose the challenge for me is that that's a pathway where I suppose the only way you can progress is that way.
So you're less hands-on.
Yeah, you do end up becoming that, and there's lots of my colleagues who'd said, "No, I would never want to do management," and I think I'd probably said that back in the day myself. But I think something that my husband remarks a lot is that, and friends say, you're very rare in terms of anyone I know that would actually is happy to go into work. They love what they do, act as a real advocate for people. And I think that's what I hold, dear, if anything, that if things do become challenging, I think it's something that things that we all come across day to day. I suppose it does frustrate me that there's not recognition of what our role is and how we can have such a huge impact on society and the well-being of people, but also in terms of the male-female, I suppose, bias in terms of would a male be as interested to come into this profession? Because I really do believe that I see it with my own children, having a male role figure is valuable to support, children to identify with a male and not always with a female. So I suppose that would be the main thing potentially that would frustrate me, is when you do get the jokes of you I have to watch how I talk, I bet you're analysing how I talk, are you going to help me pronounce things properly? That I suppose is frustrating.
Yeah, I mean, I'm from such a male-dominated industry of engineering that I've always been highly aware of being a female in my industry, but there seems to be so many more women in your industry. I'm just trying to pinpoint whether you've been discriminated for that, but I'm getting the sense that you have been less discriminated for being a female and discriminated against because the field you're in is so rare.
I suppose under-recognised or understood is probably more. I'd say in terms of being discriminated for being as a female, I suppose salary-wise, in the UK, they had something called Agenda for Change, where no matter what banding you were on, male or female, this was your salary. Whereas the country I'm in at the moment, there is quite a lot of disparity. And I know that, I know through talking to other colleagues, it depends on how you are funded or if you're in the private sector, it's very much you bill and you receive an income that way.
I often ask women that come on the show the same question, which is, what does having it all mean to you? And do you think you've achieved that?
I think having it all is being able to have equality, opportunity, freedom, and that's in terms of access to education and travel, being able to, for my own rights, they're being, available to me and not being restricted. So in terms of that, I still feel that there's lots more I'd like to achieve. I feel I've got lots of ambition. So I would never say I have it all, because I'm always working towards the next goal. And I've been fortunate to have had children and met my husband a few years ago. But in terms of where I've gone down a career pathway or in other interest areas, I've always been a great believer in. I'm a very lucky, being a Western woman, to be able to have gone travelling. I've been able to be well educated and have access to free healthcare. In a sense, I know we obviously input into it, but we don't. That's what I feel that's very important to me. I'm able to, express my views. I'm respected. I can work autonomously, and I really feel that I'm hoping my children will see that me and my husband chose to take risks, and I, as a woman, went on and continued to pursue my career and develop myself. And it wasn't just that the only thing I was focused on was just my career or being a parent or whatever it was, is that I've got that variety and the opportunity to have variety in my life. So I always feel that, I suppose the main answer is that I feel like where I'm at the moment, there's always that desire to continue and want more and strive for more.
A lot of women and girls who do enter into the STEM profession spend a long time studying. And after all of those years of studying, they then feel like they have to be focused on building a career to make all of that studying worthwhile. And so many females in STEM are unable to think about the other aspects of their life, like family and relationships and social lives and things like that. Is that part of your story, that you've had to try and achieve that balance, or has it been easier given the profession you're in to have that?
It's a really good question. I think for me personally, I chose to, I suppose, pursue my career. I mean, I qualified in 1999, and because I'd self-funded my course, there weren't bursaries available at that time. It was more from a financial perspective that I had to pay off the loans I'd taken out. And I'll never look back. That was, the best decision I made, that personal investment. And then once I'd paid all those off, I had a sabbatical and went travelling. And I felt then that I was secure in terms of having a job to come back to. I was able to go and do the travelling I've always wanted to do, but then I had the job to come back to as well. So I feel like as a profession, you can, and I think it was more so when I first started out, there was more opportunity to take a year out. And other people, other women I know, and other men and women I know in our field have gone on and gone into something very different for a year. I remember one friend went and was an air steward, an air hostess for about 3 years. Other people have come into the profession later in life. Had a colleague who was working in banking, had a colleague who trying to think what she was working something for totally different, and came into the area, to the field. One was a nurse. So I think the profession lends itself to enable you to take different pathways. My training overall was 5 years because of my undergraduate, but you're always doing additional postgraduate studies and continuing professional development, which we're required to do with our professional bodies. So I think there's always that progression to ensure that you're up to speed with evidence base and in terms of your own improvement and development as well. So yeah, I suppose it's the nature of the job. It enables you to do that more freely, and I can work across the world with doing the job I do.
Yeah, it doesn't sound like you were distracted by a need to prove yourself in a sense.
I was just so interested in what I was doing and the opportunities that came my way within my career very early on, and I think it was just the nature of how the NHS was at the time. That as you progress through, you gain more experience, and the way that your competency is built and your advancements built. I think at the beginning it was easier to find a job and move on to another area, but in more recent years, it's had a real impact across allied health professionals in terms of that they've had no bursary funding. It's gone back to where you're self-funding again. There's reduced courses available, and also not been as many jobs available. So I think what's happening often is that's restricted why people may come into the profession as well, because it's harder to get into and it's harder to then get a job afterwards. And that's across many, many areas like midwifery and lots and lots of areas. And I've found a lot of people are coming overseas to further pursue their careers because of the opportunities.
It sounds like you've been very focused along your career path. Is that a fair thing to say, or have you at times been clueless as to what direction you're heading in?
No. I think very focused, but I'm quite a spontaneous person, and like you said before, very adaptable. So what I wanted to do is, and I was always just take every opportunity to learn about a new area within the field. So I started off working in a community clinic, and then worked in a child development centre that was attached to a hospital, and then within language units, and then in a hospital, and then so I got a range of experience working with children, and then moved into different areas within that. So I suppose the focus is always that self-improvement, but also if an opportunity's come my way, I think making the most of that.
But where you are today in life,
Mm-hmm.
did you always plan to be at this particular destination?
No. I always, in terms of where I physically live now and where I work now.
No, in terms of, where you are in your career and what you've achieved in life so far, as a little girl, did you always dream of how things have unfolded, or have they unfolded in a way that you never planned?
I think that as a little girl, I very much wanted to see the world and know about people, learn about people. I used to sit with an atlas and talk to my mum about all the different, all the countries and different cultures. I've always been interested in that. And I think, if anything, I was really supported by key figures like teachers, or there may be somebody who always, I think naturally has come as I don't know, almost stood out to me, where I've seen what they've done, or they've talked to me about what they've done. And I think where I grew up in the north of England, I wanted just to, again, I think I'd just make the most of what I could have. And I think within my family, I saw that with my mom, that she did the best to get to work, to support us. And unfortunately, my dad didn't make the most of his talents within art. So I think as a young girl, what influenced me was my love of being traveling, love of people, and then I really like language and progressed that way. And when I started out in my career as a speech and language therapist, it was more to do with the variety of work that came my way, that I would never sit back and think, oh, this is where I'd want to be, because I never wanted it to be so. I've never been a person who has a 5-year plan or a 2-year plan or a 10-year plan. It was very much I'm going to aim towards this. I'd like the opportunity to work overseas one day. I was later on in life when I had children. So it was something I'd liked, I wanted to have, but it wasn't that my career was the thing that prevented me. It was just when I met my husband, the opportunities that came my way. But I think when I wanted something, I've always focused on it and gone for it and applied myself. So that I suppose part of the way I've shown an interest in something has enabled me to get to where I am now. But if you were to ask me I mean, we're hoping to stay where we are for the next 5 years. But beyond that, I'm open. I'm open to just see where it takes me, really.
I have to say, I'm incredibly inspired by your path,
Thank you.
and I don't know a fraction of your actual story, but it just sounds like it's been a real combination of persistence and opportunity
Yes.
that's come your way, which I think was it. Can't remember who said that, but was it Einstein? Someone quoted that that's a great combination to have to be successful.
Yeah.
Tell me more about the role models that you've had in your life. How influential have they been, and who were they or are they?
And I'm just thinking, when I was younger, just seeing my mum working hard when my parents divorced. She worked really hard to ensure that we did our homework, taught to us about the importance of going on to further education, but not to the point where it was if we chose a different pathway, she'd prevent that. But she taught us to also have an open mind and to really just accept people for who they are without judgment, really. And I think that's just such an important thing in life, no matter what work you go into. And I think we sometimes just get so focused on I suppose being when you ask the question about which path we're going to take and where we should be, is having that opportunity to not almost go down and be the norm, and sometimes do something different. And it doesn't matter if things don't go as you predicted. It's good to almost learn from that. Is that sometimes it's not always going to go the way you want it to, and that's okay.
A lot of the women that I interview are really impressive. And they're really determined and they're extremely capable. But a common trait that I have found amongst most of the interviews I've conducted is that they all suffer from kind of second guessing themselves and self doubt. Have you ever experienced self doubt?
Yeah, definitely. I think I was saying before around it was when my previous manager, when I started doing, suppose, more of a management role, helped me just have that confidence in myself that I can apply my skills. I can lead. I can. It's a natural. I think she said you're very natural in your leadership and motivation and innovation, your resilience. And I hope it's just. I suppose it's recognizing my strengths. She really pulled that out of me. To think that actually, yes, I can do this, and that self belief. And I think sometimes I have almost thought someone's going to come and pinch me or surprise me and say, "Oh, actually, this has just all been, a farce," because I can't actually believe how lucky I am when, I've been doing work with a child or a family, and you have those light bulb moments with them, and you can just see you've had that small impact or huge impact on the family or the people you're working with, or even other, people in my team or other like teachers or some nurses I was working with today, just seeing how we can work together. And I suppose I just almost think, is this really happening? Is this really happening to me? But I also know that I think that's just that's a very natural thing to feel. And I think it's good sometimes to, if you have that self-doubt, when you can have someone that can support you and inspire you, you learn more around recognizing, well, why is it I'm feeling that? And I always say, what can I then do about it? Why am I getting these feelings coming up? And I suppose that's just the therapist in me, analysing it all. But there will be definitely times, particularly when I'm in situations now in this new managerial role, is I may not have experienced doing something before, or I'm not sure how to go about doing something. And I do feel a little bit of a dread, almost thinking, oh, do I have to go into this? But then I just reach out to people and say, oh, I'm thinking it's this, can I have some support? And a lot of my friends have said they probably wouldn't reach out the same way. They tend to go in on themselves and not ask for help. And I think I've just been instinctively will shout out and say, no, I'm going to need some help here. So I think that's what's helped me build my confidence.
So it's like um, having the confidence, as you say, to admit when you don't know something.
Yeah, definitely. And I think that's very important in any profession, but definitely in the work we do. It can be very dangerous if we're not saying, hey, I'm not sure what's happening here. We're working with um, people's lives here. And I think that's all. We do a lot of reflective practice and self-development as part of our career. And I think that is a very important you know necessity to have, really, no matter what we're in.
It sounds as though what's pushed you through any wobbly moments has been your pure passion for what you do, but also gratitude.
Yeah, I think it is. It is the. It is just. It's so worth it at the end. I mean, even today, I was having to really work hard at pulling a presentation together about how our team had been performing. Um, and it just, other managers were coming in, we're discussing what we were doing, and we all pulled together around. We all had different strengths in different areas, where almost became, it almost took the edge off the situation. We're having to turn around things really quickly. I'm trying to set up a clinic at the moment with a radiologist, and she was challenging me, and it's become quite a joke between us now around, why am I doing what am I doing? Why do I want this? And I think it's just at the end, I know that we're going to have a really great working relationship, because it does come back to how this really benefits the children. And I suppose what we always keep at, what value is this for we've got our patients, whatever you want to call them. Because really, at the end of the day, this is what we're in my profession, in my job I'm doing, is I'm here to help people who access our service. And if you're losing sight of that, then it's that's where the gratitude comes in, I suppose, for me, is you've done what you can to try and work to support families and children.
For any young girls who have been listening to you today and think, wow, this is a profession that I could really go into, how would they go about doing it? And also, given your journey and with the hindsight you have, are there any things that you would advise with your experience?
I think a lot of it is, as well, is to do about what you're really interested in. But also, you have to be able to show that you can study. You have to be able to show that you can research and write assignments, etc. But if sometimes it's just looking at taking a step back and looking at, right now I'm really interested in this, but by doing what I'm doing, what other opportunities will it open up for me? And I think I'd always encourage anyone, like I did, I suppose, first of all, looked at wanting to do something maybe within teaching or another profession. And it wasn't until I looked into it more and actually going to places where there are different professionals that are presenting around what you can do for a career, really talk to people, try and get opportunity to go into different working settings and find out about what's out there before you even start to commit. And don't be afraid if you end up not going down the road you expected, because you will always come back to what you really love doing and what works for you. I've got some friends who aren't going to continue working in the field that they studied in now. They're going on to something else. And I think that's about life is, we don't always have to go down this one path just because. It's important to get education. It's important to be able to study and apply ourselves. But some people don't go on and, do additional courses, and they do excel in their excel in their careers. Some choose to be stay-at-home parents, and then go into something later on at life.
Gosh, where there's a will, there's a way. And it sounds like you
Yeah.
have always had your heart set on doing the job that you have today, and you've just followed your heart and somehow managed to carve out a career that really works for you.
Yeah, definitely.
What does the future hold for you? What are your plans?
With my career,
Yeah, it sounds like you've really managed to achieve a balance in both pursuing your career and getting all the things that you've wanted, like a family and the ability to travel.
yeah, I think that's what's been really important to me. And I don't know if it's just from life experience or what I've seen around me. I really do believe that it's not about just the straight path. And I think what in the ideal world, I'm really going to give such a good go at this job now. It's the where I'm working, the country I'm working in. I've got the opportunity to grow this team from scratch. We've only been as a function as a team for the past 7 months because people have moved to this certain hospital from overseas. And the country we're in culturally is providing such a wealth of experience as well. So for me, it's just really playing to all my passions in life in terms of new cultures and people. But I suppose because I'm in a position where I have children, it's providing them with that opportunity too. So I really want to give it a good go here for the next 5 years at least, and then just see where things are maybe in the NHS, or we could go on to another country and do the job I'm doing now. And I think things will come our way as we need to, and just as this job has done. Um, yeah, I think that's where I'm just heading towards is. Yeah, the next adventure where it'll take me. But it's not just the job does help because obviously it helps you to afford a living. But it's just I think I'm in a really good position that I'm able to get that balance, like you were saying as well.
Yeah, I don't know whether you foresaw the ability to have a balance in your career given the profession you chose to go into, or whether you were lucky that you were able to achieve a balance.
I'd say from the UK system, there is much more opportunity for flexible working and part-time working, etc., etc., which affords you to be able to do that. And I think because I've chosen to have a family, then because also I was 40 when I had my first child, I had to. I suppose I knew I'd worked hard enough. That's one of the things I'd worked so hard to get to where I was. Um, I had a year maternity leave on both occasions, but I didn't want to then not continue on doing my job as it was because I just loved what I did so much, and I think I just really want my children to see that I'm doing something like this as well. And I think as well I just had that amazing support from my husband, because it's a two-way thing. When you're married, when you're in a relationship, when you have a family, it is about how that comes together. But if I was single and I didn't have a family, I think I'd still have that drive, and which I did had when I was single, is to see where that took me really.
Gosh, I'm fascinated that you had your first child at 40.
Yes.
Is that because did you plan it that way?
No, I didn't plan it that way. I was in a long-term relationship until my early 30s, and at that point, I really wanted to then go on and travel. And for various reasons, we broke up. And I think all that time in my 30s, if I'd have met somebody at that point, then and it was the right person, um, and I think where I was at in life with what I wanted to fulfill, I suppose, from traveling. And I think my career was part of that, but it was a variety of things. Um, it wasn't until I met my husband, and just literally at I was about 37, that it just almost felt like it clicked into place. He was at the right point, I was at the right point, and it wasn't even that we rushed into having children. We did talk about really early on that just because of our ages, because it's equal on both sides, that we're both in the same age. Just because of our ages, we shouldn't be rushing into that. But we were very fortunate that we were able to have children at the time and when we did. And I'd be a real advocate for that. I've got a sister who had children in her early 20s as well, so she's now going on to do. She's gone on and done her studying. She's got a master's in psychology. She's got an opportunity to do more, like a PhD through her work placement now. So she's gone and approached this a different way around. So, yeah, I think that's what I'd probably come back to with that. Yeah.
I do truly believe that what is meant for you will happen. But I feel that a lot of women, particularly in STEM, do feel a huge amount of pressure to squeeze everything into this short biological window that we have. And
Mm,
so, there's a lot of questions about egg freezing and
yeah.
adoption and all these kinds of options.
Mm,
And it can be very worrying and very stressful for women to have it all.
yeah.
What would be your advice, given that you do come across as a woman that just has it all, if not like you have a lot? So, what would you say to maybe comfort women who are in this position of trying to squeeze all societal expectations in?
Yeah, I have this conversation with friends on a weekly basis. um, and I was that person myself, when I got to about 35, thinking, what do I want now? And I suppose there was that point where I was thinking, it felt almost a little bit unfair that there was the view that the clock was ticking. And I think having done, I read about it and looked into it more. Um, and I know that it's not just to do with the female biological clock, that men also, need to factor in things as well. And I think I've had friends talk to me about them wanting to go down a sperm donation route. Friends who have chosen to have a baby, even though that her and their partner aren't together. They had a previous relationship, but they've chosen to have a baby together because this is something that they really desired. And others that are approaching 40 or even 41, 42, and almost feel that that's their cut off for them. They want to pursue meeting someone with a view to having children. And it is really, I think it's tough for a male or a female when you're at that point. And I suppose, like I say, there is the view that you're at this age and this is what you should do. And I remember very early on in my previous long-term relationship, it was just because we've been together for 2 years doesn't mean we should get engaged, or this long that you should then have children or you should get married. Why should it be that way? Um, who's dictating this? And I think a lot of it's cultural as well. And I think it's kind of, a lot of this has come from my personal background, where, like I said, my father had amazing opportunity to really do something with his amazing talent with his art, and yet for various reasons he chose not to. And I just remember from being a really young age, just thinking, I'm not going to be like that. I'm going to do something. I'm going to make the most of what comes my way. So I suppose I just had that open mind to just think, yes, I really do want to travel. Yes, I do really want to do this. But I know I needed to work hard to enable myself to get the money to be able to do it. I self-funded to do my course. It didn't just happen. I had to put a lot of effort into that, and I couldn't go off and do the things that other people were doing in the 20s, because I was having to work hard to make sure I was staying in my job and paying off my debt. So there's always been things where there's been, it may be from the outside looking like she's somebody who has nearly everything, but it's not just happened. It doesn't just happen to any one of us. By putting our effort in and focusing on things, I think that's where I truly do believe is, we can only do the best we can. And I suppose we're talking with a friend now who's, our friends who are in a situation where they do want to pursue a certain path, whether it is that they want to focus, say within the world of STEM, in that role, and therefore leave, I suppose, focus more on maybe having a family or meeting somebody or going off traveling or pursuing other interests. I suppose it's just taking it back and saying, well, what's stopping that for you, and just keeping yourself open to it. I can never speak on behalf of another woman or any other person to say, what would it be like if I hadn't had children, or what that must feel like for you. But I think it's just knowing that I focused on what was really making me happy, making sure I fulfilled that, and then I met my husband. But prior to that, there was times when I really did want to meet somebody, and I did feel lonely, and I did wonder if I ever would. But I just made sure that I continued to do things I really loved doing. And I think I was just lucky to grab the opportunities when I could.
Wow. I'm really, really gobsmackingly inspired. The idea of really just staying focused on what it is that our heart truly desires. And I mean, listening to you, I feel like you are very much in flow. You're not trying to resist, and you're very accepting of opportunities and challenges that come your way. It seems as though you have an attitude of, what can I learn from this situation, good and bad? And
Definitely.
it's just been really calming and inspiring talking to you. Thank you so much for coming on the show and sharing your wisdom and your accomplishments with us.
Thank you, Shanine. I've really enjoyed it myself as well. It's great sometimes to be able to have the opportunity to just talk, and I suppose by the questions you've asked me, it's just helped me revisit so much, particularly being new in the country I'm in at the moment, and it's just reaffirmed to me that this is the right thing that I've done. If I needed any more, affirmation, it's definitely done that. But I think the things that we've discussed do come up very, very frequently. And it's great to hear that you say that you've been inspired. But likewise, and obviously with the other podcasts with the other women you've spoken to, equally as inspiring as well. So thank you.
That's it from my STEM guest this week. I feel like our chat has been not just reflective for us, but also reflective for her. And one of the key things that I've got from our conversation today is that it's so important to stay focused on our own journey, always asking ourselves what makes us happy and where our passions truly lie, and pursuing them no matter what. Thanks for listening. Catch you next week on Scilence.